getting more and more questions about stress, depression, mental stuff. We do a lot of work on that. The brain is not isolated from the rest of the body, so we're going to have lots and lots of gut, musculature, brain function. The body talks to the brain as much as the brain talks to the body. And so when we look at depression, when we look at anxiety, when we look at mental issues, there's a lot of things that are easily knocked out. So whenever we get kids, we get anybody in, I don't care if they're 15 years old or 25 or 70, like whenever somebody comes in and they've got depression issues, there's a couple of things we check first. The first thing I always check is their testosterone levels. And we'll raise testosterone levels of teenagers, 17, 18-year-olds up. And it's amazing to me how quickly, this is specifically in men and boys, 17, 18, 19, 20-year-old boys who have depression, who are clinically depressed, who are, gaining weight. Life is just miserable for these guys. And we check them and their testosterone is 220 or 230. We raise it back up to 1,000. And within like 2-3 months, 90% of their depression issues are gone. We'll also go back through and we'll start working on gut issues. So first ones, we always check testosterone. So I don't care how old you are, man, woman, doesn't matter. If you have depression, anxiety issues, get your testosterone levels checked from someone who knows what they're doing. All the women's levels are wrong. You guys need more than 40 or 50 testosterone levels. But testosterone is the first one to check. Second thing to check is, what is the status of the gut? The reason for this is that the vast majority of the serotonin that is made for your brain to use is made in your gut. That's why they call the gut the second brain. The amount of neurons that are there and everything else that is so wildly important. So the problem we get into with the serotonin creation in the gut is that we do lots and lots of things on a daily basis to destroy that ability. So antibiotics are one of the number one things we see. There's research out stating, antibiotic treatment correlating with depression and anxiety issues, and even, past, higher, longer dosages of antibiotics leading to months later prescriptions for antidepressants. So when you kill the good bacteria in the gut with antibiotics, stress, parasitic infections, whatever, there's a host of reasons that they'll die. Your body doesn't process nutrients as well. You stop producing methylation function, so the liver starts having issues. And as you start having less probiotics, you start having more yeast overgrowth. So we have yeast issues. Well, all of that is really bad for the gut. It's bad for nutrient absorption. It's bad for nutrient function. It's terrible for the adrenals because the adrenals rely on a lot of information. All of those chemicals to produce the chemicals your body needs to keep ADD at bay and things like that. Blood pressure issues, oxygen issues. So when the gut gets messed up, everything kind of goes sideways. So we've got to check on that first. We got to go through, kill the parasites, kill the yeast, restore the probiotic balance, and then give the body lots and lots of collagen. Because your body takes collagen, specifically tryptophan, takes tryptophan, breaks it into 5-HTP, 5-HTP into serotonin. But your gut has to do that. So that's the big issue. You got to restore the gut function, restore that healthy balance. Inflammation of all kinds is going to create problems. This is why we talk about the standard American diet with all the high fructose, the high glycemic foods that turn into sugar instantly, which is not the way your body's used to seeing it. That damages everything in the body. There's lots and lots of xeno and phyto estrogens. So like soy is a big one. There's a bunch of other ones that create all sorts of issues. Lots of people have inflammatory reactions to a lot of the fake foods that are out. That inflammation damages the gut, keeps it from functioning the way it's supposed to, and further propagates this issue. So when we have someone who comes in with anxiety and depression, stuff like that, we really, really focus on getting their testosterone up, cleaning their gut up, restoring the probiotic function so you can restore that creation of serotonin. And then we do kidney castor packs. We take allicin is a great one for the kidneys, kidney complex. We use those. You can find all those on the Pillars of Wellness website. We use those a lot to help clean the kidneys up, loosen that up. And because the kidney in Eastern medicine is the wellspring of life. So anxiety and depression lives a lot in the kidneys. In fact, when people come in with anxiety attacks, panic attacks, that type of thing, we'll do kidney castor packs under farm for red heat. And 30, 40 minutes later, they're totally fine. So keep that in mind as well. Those kidney packs are a big player. Probably the number one thing that I recommend next would be exercise. there is copious amounts, just ridiculous amounts of research on mental health and exercise. The reason that this works is that your body creates all this information of where you are. You're moving, you're pitched, you're leaning, you're rotated. You have this much pressure on this joint, this much pressure on that joint. This muscle's over here, that muscle's over here. All that information from your tiptoes all the way up to your nose is being directly fed into the brain constantly. Well, that relies on this very specific pathway. It's a proprioception and motor pathway. Those pathways are graded in the brain much, much higher than anything else. So what I mean by that is that when we shove all this information to the brain has to figure out, okay, I can only deal with so much of this at one time. What am I going to deal with right now? And so pain gets shoved down on the side. That proprioception, that movement, that where we are in space, how are we moving, that's paramount. And the reason for that is because if you move wrong, you're going to hurt yourself. If you don't know where you are in space, you're going to bump into stuff, you're going to bang into stuff, you're going to be uncoordinated, and that's going to cause further injury and damage. So your body listens to that first. This is why if you bang your shin and you walk it off, the pain goes away faster than if you just stood there, because you have all this other information. Your brain goes, I'm going to listen to movement and not to pain. And so it literally makes that decision. Now, the cool thing is that as you start spooling that up, all this information comes from your body up your spinal cord to your cerebellum. The cerebellum then forces it to the frontal lobe so you can make sense out of it. As you fire up that frontal lobe, it suppresses the temporal function. That's where the amygdala is. We've talked about this before. So fear, hate, anger, terror, anxiety, all that stuff living in the amygdala and the temporal lobe, your frontal lobe can help suppress that. So as you exercise, what's ended up happening is that's happening in your brain, and it's kind of calming down and telling your amygdala, dude, quit listening to this. It's not that big of a deal. Calm down. Everything will be fine. Move on. That's why whenever we tell people who have anxiety issues, who have depression issues, who have stress issues, that working out's the number one thing that they can do on a daily basis to kind of keep things where they need to be. So if you have anxiety, if you have depression, getting into the gym, going outside for a walk, doing some physical exercise is the number one thing to do. So we talk about when's the best time to do it. The best time is just getting in the day. So I like to work out between, call it 12:30 and 2. The reason I do that is because that's in the middle of my day. So I wake up and I've got to deal with all the emails that came in overnight, all the people in other countries I'm trying to work with, all that type of stuff. And so my stress kind of starts coming up, and then it stays up pretty high. And then I go home at lunch and I work out, and it crashes that stress cycle right back down to the bottom. And then the rest of the day is kind of picks back up. So I never get really high on my stress levels because it gets about here, and then I crash it back down to baseline, and I start building it back up. And I will tell you, the second half of my day is always more calm, more relaxed, and more is just easier than the first half. If you guys are not working out and trying to pay attention to that, start paying attention to that. How calm were you? How relaxed were you? The issues that were bugging you beforehand, how are they afterwards? So, and a lot of people are like, oh, so I have to work out in the middle of the day? No, you have to work out. That's the primary function. So if you can only get it in at 5 a.m., get it in at 5 a.m. But you need to get that workout in. And if you can start drifting it towards the middle of the day, maybe doing that as your lunch hour, that'll really help the entire function and everything else you got going on. Whenever I have patients who have control of their schedule, this is one of the first things we always try to do is move the workout to the middle of the day. You can do it at the end of the day. The problem with doing it at the end of the day is that most of the time you're exhausted. You've spent all the energy throughout the day. And so your workout's not going to be as great, but end of the day is going to crash that stress cycle. Go home, eat, relax, don't do any more work. You're going to get a great night's sleep. So end of the day has its upsides as well. The upside, the number one upside to doing it in the morning is that you've done your workout, it's over with, and you get to move on with the rest of your day. So if the only time you can do it is in the morning, do it in the morning. But if you have control of your schedule, middle or late of the day is going to be a lot better from a stress standpoint. So if you guys can focus on those things mental health wise, get your testosterone levels up where they're supposed to be, get your gut reset, and exercise, you're going to see a substantial change in mental health issues, anxiety, stress, depression, all those things. There's no research out that says that exercise is going to increase your depression. So now, having said that, when we work out, we're requiring a lot of nutrients from the body. So make sure your macros are where they're supposed to be. Make sure your supplementation's where it's supposed to be. Your B vitamins, your CoQ10, like all that stuff. To make sure that's where it's supposed to be. And you guys are going to see a lot of change in your mental health. But that's one of the things you got to stick with. Because for the first 10 days, 2-3 weeks, your body's getting used to it. You're going to be sore. You're going to have all these, I don't want to do this, all this, negative thought on it. So give it 2-3 weeks and then kind of see how you feel on a more regular basis for that depression stuff. So if you guys have any other issues with that, questions on that, obviously ketamine psychedelics is a phenomenal thing to add into that for mental health. We're big fans of that. I can walk you guys through that if you need it to. Send us an email, questions@chalmerswellness.com. We've got a bunch of questions right now, so we'll hit that up tomorrow and we'll answer your questions. So thanks for your time. I'll see you guys later today.